speak about for the remainder of this packet is really tying this all together, looking at the regulation of mean arterial pressure. So in short, basically looking at a lot of factors that we talked about. So things like heart rate, stroke volume, ventricular contractility, things like the autonomic nervous system, the sympathetic, parasympathetic. So tying a lot of factors that we have already encountered earlier in this semester as well as last semester, and just figuring out how they all play a role in regulating our mean arterial pressure or regulating our overall blood pressure, okay? And so we know that the determinants of mean arterial pressure are heart rate, how fast that heart is ejecting blood, stroke volume, how much blood is being ejected, and then total peripheral resistance, how much impedance or blockage to flow, right? Mainly encountered in those arterioles. And so we can prove that these things determine mean arterial pressure by going back to our equation here. And so if you remember this equation, this was our rearranged equation. So we first look at cardiac output being our mean arterial pressure divided by total peripheral resistance. And then we rearrange this equation to say that these two things, so cardiac output and total peripheral resistance, directly relate or are directly proportional to our mean arterial pressure. And so if we substitute another equation that we know for cardiac output, which is stroke volume times heart rate, right? So we should remember that earlier equation, then we can add some more specific details in terms of the factors that will then influence mean arterial pressure. Okay, so we can then say that heart rate, stroke volume, and total peripheral resistance all increase or are directly proportional to mean arterial pressure. If I increase my heart rate, I increase my mean arterial pressure. If I increase my stroke volume, I increase my mean arterial pressure. If I increase my total peripheral resistance, if I make those arterioles more, smaller, if they constrict or contract, I then also increase mean arterial pressure, okay? And so there are different ways that we can regulate these three variables. We can do so via neural input, so neurons, again, sympathetic and parasympathetic to some degree input there, as well as hormonal influence, thinking about norepinephrine, epinephrine, and then thinking about our hormones, angiotensin and ADH, right? So vasopressin, so hormones we talked about before. So these are the ways that we can manipulate or regulate these three variables, and by extension, manipulate or regulate our mean arterial pressure, okay? There's also the involvement of what we call baroreceptors. And baroreceptors, there are different types of baroreceptors, but they pretty much detect volume if there's enough blood moving around in our vasculature. And so if we have low pressures, that indicates low volume. There's not enough blood flowing. And so baroreceptors are also an important player in detecting and regulating our overall mean arterial pressure as well, okay? So let's look at this schematic here that kind of shows that relationship of those variables, so cardiac output and total peripheral resistance. And so if you look at this first part of the scenario here, this first schematic, we see that if we have a steady cardiac output, we maintain a constant mean arterial pressure, and this gives us a steady flow to our systemic organs, okay? But if we increase cardiac output, we will then increase mean arterial pressure, and that will keep flow constant, right? Remember, resistance is proportional to flow here. And so if we, inversely proportional to flow here. And so when we keep resistance the same, that means we're basically keeping the lumen of those arterioles the same. And on the other slide here, we can see that if we keep cardiac output constant, but if our total peripheral resistance increases, in other words, our arterioles constrict or contract, that smooth muscle constricts or contracts, then our mean arterial pressure must also increase, okay? So just to kind of summarize this here one more time, if we increase cardiac output, mean arterial pressure has to increase to keep flow constant. If we have a constant cardiac output, but we increase resistance, mean arterial pressure must increase as well. And so what this shows us is the directly proportional relationship between total peripheral resistance and mean arterial pressure, as well as cardiac output and mean arterial pressure. Okay, if either of those variables increase, our mean arterial pressure will too increase. All right. I'm going to pause here a little bit and see if there are any questions. And I want to speak about those determinants in a little bit more detail individually. Okay. So let's go through some of those determinants of mean arterial pressure individually and speak about how they have a separate role or separate influence on mean arterial pressure. And so we know that mean arterial pressure is regulated through the control of our cardiac output and the control of our arterioles, which is then influencing total peripheral resistance. And so there are neural controls involved there as well as hormonal controls involved. And these are all extrinsic controls of our arterial radius, right? So basically external factors that influence the state of that smooth muscle that lines our arterial. All right, so going back to this very important initial equation, the fact that flow is equal to our pressure gradient divided by total peripheral resistance. And so this just underscores the fact that our pressure gradient is synonymous with mean arterial pressure. In other words, this is the driving force for blood to move through our vasculature. So if we have no mean arterial pressure, we have no driving force for blood to flow, right? Really important to understand that that relationship between mean arterial pressure and our perfusion, our driving force for blood to move through our vasculature. And so regulating mean arterial pressure is critical to homeostasis. It's critical to keeping our bodies in good function. If mean arterial pressure dips or drops below normal, then that becomes a problem. This leads to hypotension. This leads to inadequate blood flowing to our tissues, okay? Think about hemorrhaging. Think about dehydration. Think about your blood, your blood volume decreasing dangerously so that your tissues are not being adequately perfused. On the other end of the spectrum, if mean arterial pressure gets higher than normal, this is what leads to hypertension, right? Think about chronic sustained hypertension. This is bad for our heart. It puts a lot of work for our heart to do, puts a lot of stress on vessels to endure those higher blood pressures. And so if you think about someone who has chronic sustained hypertension, this is also detrimental to our overall health. Okay, and so this is why it's so important to regulate our mean arterial pressure, to keep it within that window, which is really keeping that homeostasis at play, keeping it in that balanced normal function. Now, I want you to think about which of these two changes might be more detrimental to our overall health. So would it be more detrimental to have high mean arterial pressure, or would it be detrimental to have low mean arterial pressure? What do we think would be more detrimental? So I'm seeing high, but then I'm also seeing other responses for low. And so it would be low, right? Low mean arterial pressure would be more imminently, more immediately detrimental. Okay, think about someone who's in shock, who's bleeding out, who's hemorrhaging. There's a vascular injury, vascular tear. This is going to be more imminently dangerous, right? If we lose perfusion pressure, we're losing pressure and vascularization to all of our other tissues. So the brain, muscles, other vital organs. And so having low mean arterial pressure is going to be more imminently dangerous. And so the parameters that we're going to speak about that increase mean arterial pressure, that correct this by increasing that pressure and bringing it back to normal, are probably more important than the parameters we're going to speak about that correct or decrease mean arterial pressure. Okay, so let me say that again. The corrective measures that help to increase mean arterial pressure are going to be more important in terms of imminent danger than the corrective parameters that decrease a high mean arterial pressure. All right. Now, there are two different ways that we can regulate mean arterial pressure. We can do so in a short-term fashion. This is usually seconds to minutes. And this is where we regulate cardiac output and total peripheral resistance. And when we think about cardiac output, we want to be thinking about the two variables that further affect cardiac output, which are stroke volume and heart rate, okay? And so if we increase or regulate those variables, we can then, in a more short-term, immediate fashion, regulate our mean arterial pressure. This involves the heart, this involves our blood vessels, as well as the neural input that's coming into these structures, okay? And then the long-term regulatory mechanism here is going to take longer. So think about minutes to days here. This is where we have the involvement of the kidneys, kind of what I was alluding to earlier in terms of that blood volume regulation with our veins. So this involves the kidneys. This is primarily under the influence of hormones, again, angiotensin 2 and ADH, the two main players there. But this is how we regulate how much blood volume is being maintained in our vasculature, okay? The kidneys play a long-term regulatory role in terms of our blood volume. We've also got neural inputs here. And so when we speak about these neural inputs, we want to think about that negative feedback loop. So going all the way back to AMP1, when we looked at that homeostasis loop, we talked about some of the players involved in homeostasis. And so we're going to bring that conversation back here in terms of how blood pressure can be regulated. So we've got detectors that are pretty much sensing or detecting any changes. Those happen to be our baroreceptors, our pressure and volume detectors or receptors. We've also got the integrating centers. And these, again, are usually in the brain. Think about the medulla oblongata, think about the pons, and think about the cardiovascular centers that are in these areas of the brain where these messages are being portrayed to. And these centers will send out signals that would correct these stimuli. The next player here are the controllers. So this is basically the autonomic nervous system, right? The sympathetic and parasympathetic division that would send those signals on those efferent neurons to correct some of these changes. And then the final player here, the effectors, which are basically the organs themselves that bring about those corrective changes, mainly the heart, mainly blood vessels. We've also got glands and then smooth muscle as well. So smooth muscle on our blood vessels, cardiac muscle in the heart, and then we've also got glandular tissue that plays a role as well.